Life in a world locked down has been lonely for all of us. Those battling COVID-19 in hospitals are left to fight without friends and family. But those most alone may be the ones you've never heard of. Neighbors who are still struggling with symptoms of the virus months later.
It's been hell pretty much since March.
Ellen DeMarco woke up with a scratchy throat in late March and noticed she'd lost her sense of taste.
The next few weeks after that were pure misery. Like I couldn't breathe. I couldn't catch my breath.
Months after testing positive, she's struggling with hair loss, nausea, brain fog, and sometimes she can't swallow.
I feel like at some point in time, this virus is going to take my life. And it may not be today and it may not be tomorrow, but I feel like there's going to be a long-term effect from this.
In the state hit hardest by the virus, doctors are seeing countless cases just like Ellen, often referred to as long haulers, dealing with symptoms weeks and months after they've stopped testing positive.
We're seeing a consistent pattern in thousands of patients in multiple countries. And I think at this point, the people that don't believe it are people who just don't want to believe it despite the science, despite all the observations.
Dr. Daniel Griffin is the chief of infectious disease at ProHealth New York, where he's treated more than 1,000 COVID-19 patients.
We probably have more people still suffering from COVID, unable to return to work, unable to return to their daily life the way they used to be, than people died of COVID.
They're not just in New York. Ellen lives in Denton, and there are others who want to bring awareness to a part of COVID-19 not often talked about.
Mentally, it is the biggest roller coaster I've ever been on.
Talia Dodds is in Fort Worth dealing with hair loss, and doctors say she had a mild heart attack while fighting for air.
I remember breathing was a lot like, imagine having a Capri Sun straw and having it in your mouth and having it duct taped shut.
This thing hit me like a ton of bricks.
Kenneth Nading would wake up in the middle of the night in Dallas unable to breathe. His heart so damaged by the virus, he now calls it a squeaky toy.
That's pretty much what it feels like. I can sometimes actually hear it if it's a real quiet room and it's really going.
Callie Fields in Grand Prairie,
thanking the Lord every day,
was the only one of the four who ended up hospitalized.
I cried a great deal.
She's been home for months since her 3-week hospital stay. Her hair is falling out so much she's afraid to brush it, and she struggles with insomnia and constant fatigue.
I'm pushing the cart maybe 3 hours down. By the time I get to the checkout, I have to stop and catch a breath. I didn't used to have to do that.
For months, they all thought they were the only ones, even doubted by friends and family.
It's very lonely. It's very, very lonely. You feel like, and it's not that they don't care, because I know that they care. That is not, they just don't understand it.
But then they found a Facebook group and each other.
They are being gaslit by their doctors who are diagnosing them with anxiety.
Diana Barrett was one of New York's first COVID-19 cases and is the founder of Survivor Corps, a Facebook group for long haulers.
We're talking about 25-year-olds who were marathon runners before, and they are 5 months into it, and they can't walk to the corner.
They now have more than 100,000 members.
Banding together for us to encourage one another was the most important part.
One study found 87% of those hospitalized with the virus still had at least one symptom 2 months later.
I kind of took that step back and go, okay, now I have a group of people that know what I'm going through.
And I don't want to say gratifying because it wasn't gratifying, but it was so reassuring and so comforting that I wasn't losing my mind, that I wasn't stupid and I wasn't crazy, that it's really, really happening and I'm not imagining it.
But the page hasn't just provided emotional support.
I think that these groups have really helped to get this on the radar.
Griffin says doctors still don't know why some suffer long-term symptoms and others don't.
The current thinking is this is somehow related to some immune dysfunction that is provoked during the acute illness.
COVID-19 is not a virus where the only score is if you live or die.
So I'd like to know what I can do to convince people to take this more seriously.
Talia lost her job, so did Callie, and Ellen and her husband are now both unemployed as medical bills pile up.
Yeah, we're having to sell the house, but clearly we can't afford it. This virus has affected every aspect of my life.
No one knows how long the hundreds of thousands of long haulers will deal with the symptoms and impact of the virus.
I'll just be watching a movie, and then I'd gasp and fight to catch my breath.
But through Survivor Corps, they're now believed instead of doubted, together instead of alone.
That we have to encourage each other that we're going to make it through this.
The more people realize that this is real and that it's not all political and it's not a hoax, that maybe it'll be taken a little more serious.
In Fort Worth, I'm William Joy. Titus County is home to about 30,000 people. So in a place like this, COVID-19 cases aren't just numbers, they're names.
We were never expecting to see what we're seeing now.
County Judge Brian Lee says through March and April, they had just 16 cases.
We just prepared, and it never came.
Terry Scoggin runs Titus Regional Medical Center.
When this started, we were nervous.
The small rural hospital serving several counties has just 8 ICU beds for the 100,000 people it serves.
In May, it all took off.
Cases began popping up at the Pilgrim's Pride plant and spread through the poor community where several generations often pack into one home.
So there's quite a few people in this area who were positive that we could not get tested. And even today, if you say, Terry, I just want to test, I can't get it for you.
They now have 852 cases. Only 3 Texas counties have more cases per person.
That's not a number that I'm proud of. I don't brag about that, but it is what it is.
Titus Regional ran out of monitors for ventilators and was short on PPE.
So we just got home from another 12-hour shift in the ER.
For healthcare workers, patients were sometimes friends.
You start to think about their family, their wife, their child at home.
A 33-year-old radiology tech ended up on a ventilator for 2 weeks, and a 58-year-old employee died.
There may be one less person at the table at lunch, but we have a ton of people here at Titus who care about you.
The county was also fighting something just as infectious as the virus: misinformation.
I've got too many people that are active on social media, and these are people that unfortunately don't know what they're talking about.
That means fewer people wearing masks.
What kind of participation do we have? Not good enough.
In a county where the toll from the virus is personal, there's hope more neighbors begin to listen.
When it's all said and done, yeah, we're going to survive this, but how do you define survival?
In Mount Pleasant, I'm William Joy. Life looks different now. There are masks, lines for tests, shuttered businesses, schools, and churches. But rewinding 102 years to 1918 Spanish flu pandemic is almost like looking in a mirror.
There are a lot of parallels.
Dr. John Carlo was on the Texas Medical Association's COVID-19 task force and says one surprise is how fast the virus spread a century ago without air travel.
It was unique to travel maybe more than 10 to 20 miles.
Newspapers from DFW reveal some health officials saying it was just like the seasonal flu, and the best advice was wash hands, avoid crowds, and wear a mask.
All of a sudden, they start to realize people are dying in mass and they need to do something about it.
Few have studied the Spanish flu outbreak more than Dr. Alex Navarro at the University of Michigan's Center for the History of Medicine. Closures in 1918 weren't as widespread and only lasted weeks.
They faced a second spike of cases in many cities in 1918 because they got back to life as normal too quickly.
I agree that things are a lot more similar than you might think from 100 years ago.
City of Dallas archivist John Slate says World War I camps were a major part of life in DFW at the time.
People in the health department who went out into the community and gave public talk.
About 500,000 Americans and 50 million worldwide died.
We didn't have nearly the ability to do testing and detection of viruses. We didn't even know viruses existed back then.
A second COVID-19 wave is expected this fall. Navarro says in 1918 it was deadlier than the first outbreak in some cities.
No city was able, or no state was able, to implement a second round of closure orders that was as sweeping as the first, because the political and economic will didn't exist. It just evaporated.
Life a century ago looks strangely familiar. It would be a waste to not remember what happened then.
The nation as a whole just carried on, and it became the forgotten pandemic very quickly.
In Fort Worth, I'm William Joy. This year we've wept, worried, and mourned lost loved ones.
I'm okay. It's just emotional. It's just I can't. It's it.
This week's tears,
Please, if people don't know what this is like.
were for hope. New York ICU nurse Sandra Lindsay was the state's first vaccination after treating the hotspot's sickest patients for months.
I saw a lot of pain, hurt, suffering, death.
New York's second shot went to Dr. Eve Duracell, whose uncle died of COVID in May.
Very important day today, a very hopeful day.
Doses of hope arrived in New Hampshire and New Jersey, and it arrived in Alabama.
To know what this virus has done for our patients and how many people have been affected by it, and to know that this could be the next step in ending this pandemic.
Kevin Londrigan, a respiratory therapist in Fort Collins, was Colorado's first.
I feel safer about coming home to my family at night after having this vaccine.
Texas's hardest hit hospitals
very first person in the city of El Paso
finally had a moment of relief.
It's done.
At Dallas Methodist, Chad Bush was one of the first in line in North Texas.
You know, you're always wondering, is today the day that I'm going to get COVID? I also take care of my elderly mother who lives with me, and she has COPD, and that's been my biggest fear the entire time.
The grief isn't over. The loss will continue. But from coast to coast, we got our first win.
What are you feeling?
Just hope for the world. And this is like a light at the end of the tunnel.
In Fort Worth, I'm William Joy.